welcome back, everyone. We want to try and get to as many answers to your coronavirus, easy for me to say, COVID-19 questions. And also, we want you to be a part of this program. We're very honored to be joined right now by Dr. Eric Cioe-Pena. He is an emergency room physician for Northwell Health System. He's also the systems director of global health. I want to paint, and that's our number, but I'm going to get to the calls shortly. Doctor, I know you saw the same study I did, but I want to kind of set the stage without scaring people, but again, facts and science. These are from some of the leading epidemiologists in the globe. And Nick Kristof, for those folks of you, he did a piece on this past weekend in the Times, but he laid out a couple of models here. The worst case scenario, and this is a year from now where we could find ourselves, the 2.2 million Americans would have died, countless other medical deaths, the consequences of which ERs obviously tied up, bed space tied up, people with heart failures unrelated to the virus, but nonetheless they couldn't get the treatment they need. Obviously there's an economic depression, millions unemployed. There's a tangible fear of going out. A vaccine wouldn't have been acquired to this point, limited immunity, and then this keeps coming with waves. Another scenario, this the better one, and this obviously requires a lot of coherent, cooperative action on the governmental level, and also us getting a little lucky, frankly, is that the fatalities will be counted in the thousands, most of them being in the seniors, 80 plus. By late summer, we can return to, and I'll put this in quotes, some form of a normalcy, and we will have a shutdown nationally. You see where we are right now, a little less than 100 million Americans. That number would be even broader, one would think, to get to this scenario. The economy begins to rebound before the end of this calendar year, and then we see vaccinations for this virus, and then an immunity built up. You don't believe they're hyperbole here with that first scenario. You know some of the players that were involved in this. These are the leading minds when it comes to this, correct?
Yeah, no, the Imperial College is so good that it's one of the WHO collaborating centers for infectious disease modeling. So they really are the kind of the standard bearer when we look at infectious disease and epidemics. Nobody knows for sure how this is going to go, but I don't think that their worst case scenario is a hyperbole, no.
And I'm not looking to beat upon the president in the press conference, but when he said, we're going to, basically, he said, he said this last night in a tweet, and it's been referred to numerous times, we can't have the cure be worse than the problem. Aides have reported that the feeling is that in 15 days, now 14 days from now, that somehow there'll be a magic drug or whatever else, and that in what is projected to be not even the crest of the wave potentially, but in a worsening of the wave of this pandemic, Americans will be told to leave their houses and go back into it. You don't see any scenario, I'd imagine, where that's plausible.
No, I think we're beyond the weeks, kind of 2-week pause and this will be over kind of reality. That even in the best case scenario, we saw normal by late summer. What we've seen is in some countries that have started to relax these things, the virus comes right back, the cases spike right back up. And without some long-standing change, either a treatment that's proven effective and works or a vaccine, I don't think behavior can change that quickly. No.
And I know our viewers, when we get to your questions coming up, they're going to, I'm sure social distancing will come up. It's not just a common phrase. I know every person in the medical community says you have to do this. You have to take the quarantine seriously. If we do that, and we are all, as a community, vigilant about those practices, it will go a long way. But everything I'm read, and correct me if I'm wrong, and I read a lot on what happened in 1918 with the Spanish flu, there is no scenario where this magically goes away, even with best practices, because there is always ebbs and flows. So we may see the worst, but we'll see another spike. That happens with every pandemic historically, right?
Usually, especially when the numbers get this large, we do see another spike. We did see with MERS and SARS that they kind of just mutated and fizzled out, and that was very fortunate of us. But on this level, with this scale, I think it would be very unlikely that we'd see that much worldwide mutation that we would just disappear. Now
I want to get to what you're seeing in your hospital. and what also as it relates to equipment, safety gear, etc. But I put this in context of Italy. Last week, a first cousin of mine is a doctor in northern Italy right now, and he's right in the middle of it, on the front lines, and he described some of the horrible choices that they're being confronted with, let alone the realities. But I want to play right now a soundbite from a national health official in Italy who puts a voice to really the stark choices in front of them.
We will get to the point where the number of beds will not be enough for the number of patients. And so in that case, we will have to prioritize those patients who with the highest chances of surviving.
He's talking about triage, except it's not a battlefield, it's in a civilian world. To that end, people should remember, northern Italy, per capita has more hospital beds, more ventilators than we do per capita in the United States. So it's not like we're talking about a third world country who was completely underprepared for this and they were still completely overrun. Where are we right now really with, and I know it varies from hospital to hospital, but let's start in at least the concentrations and the hubs in the metropolitan area by and large, with beds, with ventilators, with the right surgical mask, the right dressing, etc. How quickly is the gear disappearing?
No, I mean, this is a real problem right now, and you know, I'm fortunate to work for a hospital where we're doing okay with PPE and we're keeping our providers safe. But I think nationwide and even other hospitals in the city, you've heard Mayor De Blasio say we're gonna run out shortly. I have a lot of friends that are reusing surgical masks. We are still reusing N95 masks because we're worried about kind of conserving our masks to make sure that our future supply comes in time. Yep. You know, the ventilator situation, we feel comfortable right now, but I think flattening that curve and making sure we don't have a spike is very important, because otherwise we are going to get above any capacity to make ventilators. And I think, you know, these are all finite resources, and that you don't want to put doctors in positions where we have to pick patients to receive care.
To the point of finite resources, the one thing I'm told that people tend to gloss over, because we talk about the hardware and stuff, it's the people.
Right.
We've seen certainly in Italy a lot of doctors and nurses falling ill to this because of the close proximity to the patients. As many as 9 doctors I know are counted among the dead in Italy right now. Yeah. How concerning is this? And is there a policy in place that even pretty soon, if not already, if a doctor or a nurse contracts the virus, they may need to work through it?
So we're not there yet, thank God, but it's definitely something that's top of mind on every physician's mind, every nurse's mind, when they leave their family to go into work, knowing that, you know, that personal protective equipment is limited, knowing that healthcare workers have an increased risk of having more serious disease because of our level of exposure. This is something that we think about every time we kiss our families goodbye. And it's one of those things that I think we need the nation to rally behind. It is one of the resources that it takes a really long time to make a doctor or a nurse, much longer than it takes to make a ventilator.
And the unbelievable heroism, not because you're sitting here, but it's not just the doctors, the nurses, the RNs too, and the people who go in to sterilize the rooms, that are working around the clock. But you have retired doctors and nurses, seniors, coming out of retirement, knowing that they're in one of those groups here that are most at risk. Because they know they can help, and they're doing it. I want to take a quick break, Doctor. We come back, I'm going to let you guys voice your questions here, and the doctor will answer them. Please, if you can, everyone, make sure you have your TV sets down when we pick up the phone, and also make your questions as tight as possible so I can get through as many as possible. That reaction right after this.